Ladies and gentlemen, comrades and friends of the OR Tambo School of Leadership, welcome to yet another episode of Tintswalo's Perspective. This is a platform where we have engagements with young people from a variety of sectors about the work that they are doing in order to transform society, but also to share their perspectives about a variety of issues, as well as share their experiences of the last 30 years of our democracy and their vision for a future South Africa. Today, I'm having a very interesting conversation with a brother that I respect so much, someone who has personally contributed to my growth as an activist and as a person in general. And we'll be having a discussion on the NHI. And the question that we seek to answer is that is the NHI the right direction towards ensuring universal health care? And we thought it's important to have this conversation because the signing of the bill, the NHI bill by the president last week, sparked a lot of public commentary as well as public uh, discourse, which is not new because the issue of the NHI has been something that has been on the pipeline for quite some time. So, today, to help me unpack what the NHI is and to give their own perspective about the NHI is a brother and a good friend of mine who, as I've said, has contributed dearly to my own growth as an activist and as a person. And this man goes by the name of Bhekithemba Mbatha. So I'm going to invite him to the space to help us unpack our understanding of the NHI from a youth perspective. And I think it's very important that we're having this conversation from the perspective of the youth because a lot of people that are engaged in this discourse are old people. So we've been hearing thoughts from, relatively old people in society. So it would be important to also posit the voice of the youth in this discourse. So without any further ado, I'm going to bring my brother, Bhekithemba Mbatha, to the space. Comrade Bheki, thank you so much for joining us today. It's such a great pleasure to have you to assist us unpack this important conversation of the NHI. Can you kindly introduce yourself? And as you introduce yourself, please tell us a little about your activism journey, where it started, and then we can be able to get right into the conversation.
Yeah, no, thanks. Good evening, my brother. Thanks for having me. And also, good evening to your viewers at home. Thanks for joining us today. My name is Bhekithemba Mbatha, as you've said. I started my activism when I was a student at WITS, when I was still doing my Bachelor of Arts. I joined the student movement called SASCO, the Young Communist League, and at the time, the African National Congress Youth League. And I grew from the structures, led SASCO. I think we were together in a branch task team when I led as a convener, and I also got elected to lead as the regional secretary of SASCO in Johannesburg. We participated in the famous Fees Must Fall, and we also participated in all the other struggles and other, struggles of the workers on campus, struggle of the students on campus, and also trying to bridge the gap between the student and the academia. I think we played a huge role in doing that. And yeah, I don't think there's much that I'd say, but that's the brief background that I can give about my role in. It's purely based on student activism.
No, thank you very much, my brother. Just to continue, just on this personal touch, as we kick off the conversation. What do you do now? What is it that you do now for people who don't know? What are you currently engaged in?
I'm currently an attorney, an associate at the Motoring Bill Attorneys. I'm in the labor and employment department. So on a daily basis, I deal with the labor issues and employment issues that workers and employer face. That's much it. Yeah, that's what I'm doing now.
No, thank you very much. I guess it's no surprise that you are in the labor department. I mean, some of us were introduced to Marxism by yourself. So it's really interesting to see that even in your professional life, you are still pursuing those struggles, of course, in a different manner. And we are proud, to see you grow without losing the revolutionary consciousness, even in your professional life. Now, let's start off here. What is your reflections on the last 30 years of our democracy? And this is a question that we pose to each and every guest that comes here, because in part we say this platform is to share that reflection from a youth perspective, which is very important, because a lot of times we hear reflections from old people, and you don't hear the voice of young people when we reflect on the last 30 years of our democracy. And of course, given that we are just from a month, we were celebrating the 30-year anniversary on the 27th of April. That has formed largely part of the public discourse, especially considering that we're going into elections. So, what would you say your general reflection is? And in answering that, what would be your vision for a better South Africa building on the last 8 years?
Look, I think we've done quite well, and I'll speak up in terms of the judiciary, health, and also education. With the judiciary, we have courts that are running efficiently on daily basis, from small claims court to the apex court, the constitutional court. The courts are running efficiently. They have systems in place, and the rule of law is applied. So judges are independent, magistrates are independent, and the NPA is independent. So people have access to justice. Even though we still need to build more courts and still need to make maybe our legal access to lawyers more easier and accessible to people in rural areas, and especially women and farm workers and people that are that can't afford a lawyer or don't have offices of the legal aid, or don't have offices of any lawyer who's dealing with pro bono matters. But I think we've done quite well to make sure that the rule of law is the order of the day. I mean, court decisions are adhered to by government, by business, by individuals. So that alone shows you that we have a good judicial system, and we have the rule of law is running is the cost of it runs the cost of the day. So we do have systems in place for that. With the health system, a lot. I mean, we're going to be talking about it quite a lot today. But with the health system, we have hospitals, we have clinics that are running, and people have access to healthcare. We still have a lot to do, but at least we do have hospitals. People have access to medication. People have access to pharmacies. So we've done quite well in that regard, even though there's still improvement that needs to be done. On the education system, I'm a product of NSFAS. From my first degree to my second degree, NSFAS funded me until the last year. So I mean, there are many others, and where I work, there are many others that are my friends, my colleagues that have been beneficiaries of NSFAS. So at least education now. Yeah, I mean, education. People now have access to education. My father, is not someone that is educated, but he's proud of his son, that his son is an attorney. At home, I was the first person to graduate, and there's many people that can tell such stories that look, they're the first people to graduate from their homes. So at least we do have thousands of students that are benefiting from the NSFAS system. Yes, there are problems with NSFAS. Currently, I'm told now that they don't fund for LLB if you have another degree. But I mean, there are products of NSFAS. People that can say they benefited from it. There's also institutions of higher learning, both in the in TVET's sector, and also in your you also have universities that are running on daily basis, that enjoy institutional institutional independence. And so that alone shows you that you have a country, and you have beautiful stories of people that are benefiting from these things. Of course, as I said earlier on, there are some room of improvement. But for 30 years, if you look at the number of graduates we've produced, you can tell that we are going in the right direction. If you look at the number of young kids that have access to basic education, then that alone can show you that we are at least every child that is of the age of being in basic education, they are at school and they get a meal on a daily basis. So that alone shows you that there are some positives when it comes to education. Is the education system good? Maybe that's a debate for another day. But it has produced you and I. It has produced doctors. It has produced some engineers. So we are moving in that direction. So I think with my reflection will be that at least in education, health, and judiciary, because for me those are the most important elements of any country. If you don't have a judicial system, there's no rule of law. If your education system is not up and running, you don't have you're dealing with you don't have good professionals, because you're not producing any professionals, and there's no knowledge that's being produced. And also, if you don't have health systems, then people are going to die because they won't have access to health. So I think those for me are crucial. Yes, the economy is crucial, but the three become the backbone of the economy, because you can't have the economy if you don't have the three. So I think we're doing quite well.
No, thank you very much. And I guess the implicit implication there is that we need to build on these things to ensure that this democracy is sustainable and continues to bear fruits that will improve people's lives in real terms. Um, so before we get into the crux of the matter, there's one more personal question I want to ask. You've always been a person who is interested in ideas and exploring different ideas. I mean, you're one of the activists I've met who wrote a lot and produced quite a number of useful papers, which we still refer to today. In fact, I must admit, in most of my academic work, I always refer to some of your papers. You know that every now and then I would say, Comrade Beg, you once wrote a paper on this. Can you please reshare that paper? There's something I want to refer to. I know that you have an account of academia, I think it's academia, where there's still some of your papers there which are quite useful. Why do you think that's important? Why do you think theorizing is an important thing in the struggle and in activism? And what led you to write, Because even today, as we discuss the NHI, will be making reference to a paper that you wrote in 2018, particularly on this topic, the NHI. So what drives you to put those ideas to paper?
Yeah. Well, I'm shocked you quote me for in your academic writing. I'm not a professor. I'm not a professor, man. I think you must be cautious when you do that. But yeah, I'm really happy. I'm really proud that you do this. Look, we without writing, we won't have we won't be able to archive, and we won't be able to tell our stories. That those are for me are the two basic elements of writing. People write because they want to. Firstly, they want to record something. A particular. It doesn't have to be something significant or something too big, but they want to record a particular experience, and they also want to record a particular feeling or emotion. That's why there's art. That's why there's books. That's why there's even if you want to look at it from a religious perspective, every religious belief that we have, it comes from a book, the Bible, the Quran, and all the other forms of written work. So for us to produce knowledge, and for us to understand knowledge, we need to go through the knowledge that is already there, because there's nothing new under the sun. But also but you can't write something if you have not read and applied your mind and understand what other people are thinking. So for me, I think writing will never stop. Writing started a long time ago. People used to write down on on the ground because they wanted to keep their ideas, and they also wanted to make sure that they have this memory that everyone can go to when they want knowledge or they want to understand something. So that's the significance of writing. You need to record everything that you do, and you also need to archive so that there's institutional memory, and also other people can learn from your writing and from your works. So, but also, I think it's also important to share how you look at society. I think if I still remember well, Karl Marx said, "Look, others are busy theorizing, but they're not really putting that into practice." So I think before we put something into practice, sometimes, not all the time, sometimes when something is in writing, it becomes easier to put in practice because you would have understood the liquidities, the ingredients that are needed, and everything that is important for you to do. So writing is very important. It becomes a compass to any country that wants to develop, to any revolutionary that wants to think, to any professional but that wants to understand what they do. They need to write, they need to read. And also because, look, communication is important. Everything stems from communication. So writing is also a big form of communication. You can't communicate without writing. Well, you can do it by talking, but at the end of the day, once something is written, even if you forget it in your mind, you can always go back to it and read it again. So for me, writing has always been that. It dates from far back. I think I was in grade grade four, grade three already. I was writing my speeches for when at school there's events. I would sit down and write my own speech. Then the teacher would just correct the grammar, correct the English. Even in Zulu, I'd write them down and then go read it in front of people. So for me, I've always understood that it's really important to write things down. But also another thing why I love writing, or I love writing is important, is because you read. You can't write. You can't write without reading. Reading is very important. So once you read, you write. So I think that's important. But I think the more I grew older, I started writing quite little than I used to write before. But because my belief has always been, the younger you are, that's when you must read a lot of books. Because when you get older, you get busy, man. You start having a child, start having a job, start having responsibilities, and I'm not saying it's an excuse. You still need to read and write. But when you once start reading when you're younger, these ideas are with you. No one can take them from your mind. No one can take the paper I wrote in 2018 about NHI. It's written there. It's there. It's archived. So, and I can now develop it. I can develop it from back then, because at the time I wrote it, it was still a discussion. Now it's a policy. Now I can develop it. So I have something to work on when I'm developing this discussion. You see, so that's why writing is very important. And I'm saying, as I'm saying, you need to read a lot, and then the writing becomes easier.
No, thank you very much, Comrade Becky. I must say, as I said, part of the contribution that you've made to some of us is this yearning to inquire through reading and even writing. Some of us were not that confident in terms of our writing, but the more and more we saw you write, we would be inspired, write some things, send them to you, and I think it's very important now more than ever, particularly for us as young people, because now at least even the levels of educations among the youth has increased. And it means that we are better off in terms of having the right skills to contribute to the ideas of society. Right now, society is grappling with the direction that South Africa must take post elections. And I think it's the voice of young people that must rise above all voices, not only in terms of what we say orally, but also in terms of our contributions through literature. It becomes very important. Now, let's get into it, Comrade Beg. You wrote a paper entitled The Need for a Strategic Reform of the Healthcare, Understanding the NHI. And maybe let's start from a definitional point of view. And maybe if you could share with us your understanding of what is the NHI, what does it seek to achieve, and where does the idea really stem from?
Yeah, that's a hard question. That's a hard one. I'm joking. Well, look, the NHI is a policy that deals with access to healthcare. It's not the first policy which deals with this. However, with the NHI, we see reforms in three important aspects, and these aspects are also found in your World Health Organization. They say that if you deal with the policy of health, at least you must address three important dimensions. And the first dimension is that you need to deal with the population cover, the population aspect of it. Population aspect of it says that you need to understand the people that the health policy will be for. Where do they come from? Who are they? What type of diseases they are faced with, and what's their life expectancy, and what's the exponential growth of that particular population, so that once you understand the people, it then becomes easier for you to build your health institutions, and the type and forms of health institutions that you want to build. So the first important thing that the NHI that it focuses on will be the people. So I'll go into detail when we discuss these dimensions each or one by one. The second dimension, which is very important, that the World Health Organization says we must look at, is your service coverage. So your service coverage deals with what type of professionals you have to offer services to the people that you've defined in your first dimension, and what type of institutions do you build to then cater for these people. And it also looks at what type of care do you give. Do you give specialized examinations? Do you give general examinations to these people? And I'll explain these things once when you talk about them on each again when we talk about each dimension. And then the third dimension that the NHI deals with, and that the World Organization says we must deal with, is the cost coverage. And I think this is where everyone is focused on the costing of the NHI, and that's where and people are speaking about, hey man, we still need our medical aids. So the cost coverage, you look at how do we fund the policy or the system that you want to use, but also it looks at how then do we collect revenue. So you understand that in the current system, before the NHI, you will use a means test to see if you can pay for services that are being offered by hospitals, and then afterwards they will try to collect. And currently I think we're collecting around 1% of the revenue. So the cost coverage, you're looking at that. How do you fund this? And if we do fund this from the state, from the individuals now, when individuals are using the system, what means are we using and systems are using for them to be charged? So those are three important dimensions that you look at when you deal with the health policy. So the NHI then becomes divided into those three dimensions. And I don't know if you want me to speak about them now, just to explain it, or you want to ask to lead me and ask me those questions.
Yeah, I think before you delve deeper into those three aspects, population coverage,
Yeah.
service coverage, as well as cost coverage. I think
Yeah.
those are the three.
Yes.
Um, just give us a brief context of
Mm.
the South African healthcare system as it is today,
Mm.
because there's something that I found quite captivating in your paper, where you say South Africa has a dual health system, which, and I quote here, has its womb in 1652 and its birthmark in 1897 through the embryo of racism and capitalism and the implementation of the Public Health Amendment Act of 1897, respectively.
Yeah.
Can you just please unpack that?
Mm.
And as you unpack that, then in each of those, then you show us in the current dual health system, how do those three aspects play out, so that we understand what is the NHI trying to respond to within those three umbrella pillars of healthcare.
Yeah. With the Public Health Amendment Act of 1897, what the act did, it separated the people based on race. You would have white health institutions having very few patients that are admitted to the hospital, and with a lot of doctors. per patient. So which meant that they then had more access to health institutions, and they were easily assisted because there were many doctors that were designated to assist them when once they get admitted to hospital. And also these hospitals had not only doctors, but they also had other professionals, your psychologists, your orthopedics, your surgeons that are, and many other professionals that are needed in the hospital to not only just assist the patient when they're sick, physically or through examination, specialized examinations, but also assist them in other aspects of their life through seeing a psychologist and an orthopedic, in that effect. So they were really assisted, and they had access to its health institutions. But also you had another form of people that were created, which would be us, the black people, that had very less doctors and very less professionals in the institutions, but a huge number of patients, per hospital. So it's dual because it was based on race, number one. Number two was also based on the type of quality that these professionals are in these hospitals. And also, not only that, the manner in which a disease was treated is different. One, they only had doctors who focused on the wound or the disease, but the others had access to other forms of disease that may not be physical. So your mental health issues, and also what you do at home and how it affects your health stability. So at least the other ones had better access, but the other ones only focused on you being sick. So you saw one system focused. It was really a system that is proactive. It was not dealing with you when you come to the hospital. It deals with you. It tried to maintain you so that you don't come to the hospital. But the other system didn't maintain you. It only dealt with you when you were in the hospital. So it was a bit of a reactive system and not a proactive system. So that's why I'm saying that. That's why when we understand the South African health system, the bedrock will be the Public Health Amendment Act, because it came with a lot of racist policies when it comes to access to healthcare.
No, and would you say, I mean, especially on the last point that you ended on, that one healthcare system specifically dealt with you at the point of, you entering the hospital. So basically, it focused more on the treatment rather than the preventative measures, right?
Mm, mm,
And when we look at our public healthcare system today, and particularly the private sector, it would seem as if that trend is still continuing. I mean, when you consider the fact that a lot of healthcare services that are being given in the private sector only happen at a point where you are going into the healthcare facility, but there is very little investment on education, on preventative measures, and campaigns for preventative measures.
yeah.
So would you say some of those trends that you spoke about are still prevalent today? And of course, I've just cited one example, which is very relevant to the private sector.
Yeah. There's a paper that I think you must read and the viewers must read. It answers that question. It's by Matsebola T. Willie. He wrote it in 2007. I know it's old, but it's a very informative paper. The paper it's published in the South African Health Review of 2007. What he says is that the so the Public Health Amendment Act gave birth to what we now would have understood as the private hospitals, and he wasn't comparing the type of professionals that are in the private hospital and also that are in the public sector, and he was saying that in as much as all of them deal with disease and sickness, but it seems like with the private sector, they rely a lot on preventative measures so that their patients don't come back to the hospital. And so they look at your lifestyle, what you eat, where do you stay, So they have a scope of their patient. So the relationship between the doctor and the patient, or the hospital and the patient, is not just about you coming to hospital for your health services, but it's more than that. They want to understand you. They invest in you so that they then assist you in your daily life. And so you can have very few times when you come to hospital. So they try to maintain you and live longer. So he says that that's what they use. And I think this is contrary to what we think, because we think that private hospitals are expensive, so they want you to come sick and keep coming. But it's not the case. It looks like they invest more on the patient, and it's understandable because there are very few people that are coming there than in the public sector, where you have a lot of beds, but only about 2 or 3 doctors dealing with a lot of beds. I don't remember the stats correctly. So he was looking at that, and therefore this falls under population. Remember the 3 dimensions. It falls under population. So the NHI, what it does, the NHI says the first thing that we will do is we will do some scope. This scope is going to show per society, so per community. Abantu base Orlando, people that are from Orlando, what is it that they are mostly, what makes them sick and come to clinic or go to hospital all the time? So we do a public scope or a public profile to understand your patients. So with NHI, that's what's going to happen. The hospitals would know and clinics would know the type of people they're dealing with, the type of disease that they're exposed to, and also they will understand their lifestyles, so that the treatment speaks to the lifestyle. It doesn't just speak to you being sick, you being given a medication and to go drink it, but it also speaks to how do you assist you not to be sick again. So that would be the first thing that the NHR would try to do when dealing with the issue of population. And how are they going to do this? We are going to have an online system where you can go to any hospital. I think you're going to use a fingerprint, or I don't know what they will use, but that thing is going to show you. It's going to show your health profile, your health history, where you come from, so that when the doctor assists you, they already have your record. Because currently, many people lose their clinic records because it's paper. You go to clinic, they give you a paper. But with NHI, this would be in a technological system where the profile would be there, and the doctor who assists you, whether you are in Kwakwa or you're in Soweto or wherever you are, will have access to all your historical medical records. And they'll understand where you come from, and also get to understand the society where you come from. And then when they assist you, they won't just give you a pill so you go home and take Panado, but they are going to understand you and be able to give you treatment that speaks to your needs and where you come from, and so on and so forth. So on population, NHI would want to address that. That would be the first element that they want that it wants to deal with. But also, the population, NHI says we realized that the type of professionals that are in the private sector is not only just doctors, but there are other professionals. So what they're trying to do now is to say that we want to attract professionals and experts to come and be in our clinics or in our hospitals. So what they're going to do now, they are going to make sure that we have professionals that are in these clinics, coming to diagnose patients that are coming to the hospital. So you won't just go to a clinic in Orlando and find a nurse or sister there. But now what you're going to have a psychologist, you're going to have other professionals that are also going to see you and assist you, so that you get assisted. So on population, we deal with the profession, the profile of the patient, the profile of the society where the patient comes from. We also deal with attracting the professionals that are going to come and assist the patient. So it's now more people-based than the current system.
When you say that, especially on this data mining part, I was actually arguing with someone that part of the reason why perhaps private sector is so resistant, it's also because of this data that they have. Because I mean, For example, if you look at Discovery, now they have become an authority on health issues, not only in South Africa, but internationally. And part of how they achieve that is as a result of the data that they have. I mean, we all know that data is a commodity nowadays, that can be exchanged, that can be used for technological developments, so it's very important as well that as we advocate for the NHI, we stress that data mining part to say it's in the interest of the state to actually have that data in its hands, to know that in this area these are the kind of challenges that we have, healthcare challenges that we have, and therefore these are the kind of interventions that need to be specifically directed to that area. So I think that's a very important point. So let's expand on the other two before we move on to other things, because I would also want us to talk about the disparities that exist currently between the public and the public health care systems.
Yeah, on the we are now moving to service. NHI is beautiful, man. On the service, NHI says we are going to build, because currently you have a clinic in your ward, you have a district, you have a provincial hospital or a national hospital. NHI says we're going to build a municipal-based primary healthcare clinic, right, for primary healthcare purposes. That will be built. It's going to be there. I wasn't saying to the paper, it has to be 24 hours, because that will be your primary health, place where if you have flu, you have primary health, you have flu, you have stomach ache, headache, that's where you go. So NHI says we're going to build that and make it be ward based. Every ward will have its own primary health care outreach, teams. That's what they want to call it. And then at the district level, you're also going to have your clinical specialists that are going to be there. So a clinic will not, as I'm saying, on the district level now, it won't just be the nurses, but it will have other professionals that are going to be there. And also in your provincial and national, you'll also have these professionals. So the gap. So now when you're sick, really sick, we don't have to rush you to hospital. We can take you to the district, because at district level, you're going to have access to professionals that you would have gotten in the hospital. What does it do? It then says that it takes away the pressure that is at the hospital, at the provincial and national hospital, because now your district can deal with diseases and viruses, or even other health concerns that are only dealt with in the provincial and the national hospital. So you're closing the gap now. You're building more access. So care, so services will be based on that. So the phase one of NHR will be about that. Will be about building these institutions. Will be about building this data that you and I spoke about. Will be about attracting these professionals to then come to these hospitals and clinics, so that they have access. I was even saying that in the paper that we need to also build polyclinics. So polyclinics will be clinics that don't just deal with the disease only, but they also deal with other your psychologists. They also deal with your social work kind of thing. They want to understand and frame the patient in the society. So that's, I was saying that I hope it's part of the policy, the act. I haven't seen the act, but at the time, one of the discussion was that let's also build our polyclinics. So with care, that's what we'll be looking at. But also with care and services, we're also looking at the issue of understanding a disease. And I don't want to open the can of worms about HIV, about President Begi's assertions about syndrome and the virus. But if you want to understand what he was trying to say, is that we must not only focus on the virus or the disease, but we must also focus on what is this person exposed to. If we deal with that, then the disease and the virus automatically might be dealt with. So we don't look at the output, but we look at the input and the process, and then the output will be dealt with by if we're able to manage the two processes. So the or when we deal with services, we need to professionalize the services, so that we then deal with, as I said earlier on, we prevent these diseases and we prevent these viruses, and they also don't spread. But how do we do that? We do that by not only focusing on the end product, but also on access to institutions, on access to professionals, and also access to the services that are offered in that particular institution. So I think that's what we'll be dealing with. Um,
Yeah.
on
Before you move on to the cost coverage,
yeah.
there's just a number of things that come to mind that as you speak. I mean, one of the things I'm thinking about is that once you have that data and you are able to get information on what are the common causes of disease and what diseases are you actually struggling with, of course varying from location to location. This may also help also in the development of a responsive pharmaceutical industry, that will support the NHI. But also, I think there has been a conversation about how do we bring in indigenous knowledge systems when it comes to healthcare, right? How do we bring in, people who use herbs to deal with certain diseases? I mean, you'd remember during COVID,
Yeah.
sonke besifuna umhlonyane, we wanted blicom leaves, and there were just these herbal remedies that we relied on. And I think the NHI also can help us to, particularly on that service coverage point of view, help us to actually bring this indigenous ways of doing things into the healthcare system, which I think is a very important part of transforming the healthcare that we need to really start advocating for, particularly in the context of the NHI. So before you go to the cost coverage, um, can we at least get a sense of the disparities that exist between the private sector and the public health sector? And I'll just like to quote a number of things that you mention in your paper, where you say that, for instance, in the public sector in South Africa, one doctor is assigned, or the ratio of doctor to patient is that there's one doctor for 4,219 patients. That is in the public sector. And then in the private sector, there's one doctor to 601 patients. So you can see already there's a disparity there. And in terms of the population that these sectors service, public sector services about 84% of the population, and private sector services 16% of the population. You also mentioned a study that was done by Mediclinic, which shows that there is 77.6 doctors per 100 lives or patients in South Africa, which is about half of the world's average, which is 152 doctors per 100,000 lives. And there are 403 nurses per 100,000 lives in SA, which is much lower than other developing countries. So what informs these disparities, and how will the NHI actively help in bridging this particular gap?
With the Mediclinic report or study that they did, they said the biggest issue for them is that our doctors go abroad, and other health professionals, they go abroad, they go and work overseas, and therefore for them it was a skills issue. They were saying that they're just leaving the country to work to work outside, and that's a big issue that at least Mediclinic in 2016 found. But also, I mean, Kifensa, you and I can count how many medical schools do we have in this country. Um, I don't think I don't think we have more than five. I don't think we have more than five. I tend to be corrected, but I don't think we have more than five medical schools. So I think we need to invest more in building medical schools, and creating more health professionals. I think to cure what the Medical Clinic was saying in 2016, which might have changed or might have worsened now, because this was written in 2018. So maybe it's worse or maybe it's bad. I don't know, but that stat is very bad. So we then need to work on the skills and creating the doctors. I remember a friend of mine who's a doctor. Sometimes they do about 48 hours double shifts. So you can imagine how he's tired, um, and he sees a lot of patients. He works in a public hospital. He sees a lot of patients per day. So you can't have one doctor working 48 hours. It just doesn't make sense. So I think we need to build, to create more of such. But also, what's funny is that I think a month ago I saw in a newspaper article where I think in KZN there was a list of health professionals, doctors who graduated and they can't find jobs. So it's also a bit. I never understood why a doctor will be sitting at home being unemployed when we have this issue in the public sector. So. And for other people who write a lot about health, they say that the issue is with funding, and the issue is with funding the our health institutions, and so therefore they think that, look, doctors are not getting paid, so they leave, or if they are getting paid, very few of them will be able to get the jobs, and some of them are saying that, look, there's very few hospitals, so that's why you'll have such big numbers. One doctor saying a lot of numbers, but I think it's an issue of, I think we must go back to create institutions of higher learning. So NHI, on that, at the time, it was the discussion was, how do we attract doctors internationally? How do you attract doctors that are in the private sector to come to the public sector? And also, how do we make sure that people that don't afford medical aids and don't afford cost in private hospitals also have access to private hospitals? So maybe if we then insure them, then that's why NHI comes in place. If we insure them, then when they go and get the services in the private sector, we then pay, the government will pay a subsidy to that. So maybe that can also work. But I think we should not rely only on that. I think the issue is more than just sleeping in Mediclinic or sleeping at Baragwanath. I think the issue is building more Mediclinics that are under the state than trying to close the gap by just creating the access in the private sector. So I think that would be my personal view. But what NHI does is that it ensures you to have access to these professionals or these hospitals when you can't afford.
No, thank you very much, Becky. And I think I agree with you that the producing of more medical or healthcare practitioners, it's a very important one. And in fact, not just in this industry. I just think as a country, we need to build more institutions of higher learning um, as much as we possibly can. I mean, when we started this conversation, you mentioned education as one of the most important elements of society, particularly a developing country like ours. Education becomes extremely important. I mean, outside of health, we're speaking about issues of reindustrialization. You need to skill people. To do that, you need institutions that are dedicated to that. Now, let's come to the big question. Uh, and maybe I must beg your indulgence that we'll go overboard a bit. I know that you're still at the office,
Yeah,
so
that's fine.
that if there are any questions that are coming through, we can also slot them in. I can see some comments, and
Yeah.
we'll flight them on the screen. So let's come to the big question of the funding, which I think also will cover that cost, that cost coverage, which is the last third dimension of those three dimensions you spoke about. We already spoken about population coverage, service coverage. Now let's speak about the cost coverage and answer the question, how will this policy be funded? And I think this is a very important question because it has raised a lot of scare in society. You know, there are people saying, hey, our taxes are going to increase by exponential margins, you know. So how is this thing going to be practically funded?
Yeah, the funding model, at the time when the paper was written, I mean, the issue with this is that I don't know what's in the act. I mean, I have not seen the act, but the funding model at the time when the paper was writing is that there were there was going to be an increase in general tax, and also an increase in government spending on health, and you will have issues of your mandatory health care contributions by employees. So a health tax, you know, would be introduced, and also the removal of tax subsidies on medical aids. I think that's the biggest contention now with your private medical aid companies, and also there was an idea that we need to then establish a pool fund. The pool fund will be governed by your NHI fund, which will be a different institution that will be run by its own CEO, will have its own employees, and will be funding the NHI. So those will be the suggestions that were put at the time. So I'm not sure if they are still going to continue, but I know that with the issue of the removal of tax subsidies on medical aids is a big contention. I know that some medical aid schemes have had a big issue with that, because it means that very few people now want to use medical aids if the medical aid is not subsidized by the state. So, and also the issue of tax. People are saying that, look, if you increase tax, it might be a problem. And also the issue of the health tax. Some people are saying, and it's going to be mandatory at the time as the state government is going to be mandatory. Some people are saying that, look, we're going to be paying a lot of tax. But these will be the mechanism that the state, and also I forgot to mention donations. Donations will also be a form of funding the NHI. So, and look, it's the state. The state wants to fund something, and one of the primary acts that the state would do when it wants to fund something is to look at the taxes. So yeah, it's a tax question. It's a tax discussion. And I'm sorry to be the one that is saying it, but that's the truth of the nature. So, but I don't know if that has changed. But that's how the cost will be done. But what does this does? It then takes away what you call out of pocket payments. So out of pocket payments will be when you go to hospital, the test is done, then you pay. So it takes away from people who can't pay. So it takes away that, then they get covered by the state. And also, I think one of the things that we need to discuss, different, is that NHI doesn't mean that you won't have medical aids. You're still going to have medical aids, but what it means is that some services, or your health services that are offered by medical aids, might not be under the NHI. And some people are going to say, but why do I need the medical aid if the NHI will cover this? But not all of them are covered by NHI. Your fancy surgical things that people do are not going to be covered by the NHI. Only primary health gets covered by NHI, so that people have access to primary health. So I think we need to work on this, because I think it's also in line with your national development plan, because the NHI says you need to create a system where tax is efficient and is used efficiently. And if you look at how SARS have been collecting, they have collected, I think a billion now. So SARS is doing well, it's collecting quite well. If we use those funds quite well, then we might not increase our taxes, but we then probably just adjust the state's funding of health And I think we might if we pressurize that, I think we might be able to survive with NHI funding.
No, no, thanks, Commissar. I think, oh, sorry, I'll call you Commissar because I'm used to that.
No, it's,
Uh,
it's
you know,
fine.
I, you know, I get the fact that, the state will always rely on taxes as its primary source of revenue,
Mm,
but I think there are also a number of ways that, can be considered to
mm,
ensure that even if there are tax increases, they are not
mm,
significant. And I think one of them is this establishment of a sovereign wealth fund. It's
mm,
something that we need to take serious because some of the revenue that we'll get from that fund could be
mm,
used to fund this policy and other, government expenditure priorities, but also increasing the tax base itself by
mm,
creating
mm,
jobs.
mm,
Because, in fact, the gap that is, or the estimate of increase, that gap can be covered if there is a significant increase in the tax base itself. And I
yeah.
think the worrying part is that unemployment is rising, and which then decreases particularly the income tax base. So we really need to ensure that government does whatever needs to be done to ensure the creation of more jobs so that we can have an increased tax base, because that would mean that the revenue increases. And lastly, I think also the issue of getting our state-owned enterprises in good shape and
Mm,
ensuring that these state enterprises, as they develop, they become competitive on a global level, so
mm,
that they're able to participate in the market, not just only in South Africa, but also taking advantage of globalization and being able to compete, international. I mean, if you look at China,
mm,
the Fortune 500, most of the companies that are included there that are from China are actually state-owned companies,
mm,
meaning that they are able to generate revenue externally and be able to fund some of the internal developmental projects. So I think
mm,
it's very important that um, these things we get them right, so that the implementation does not take 10 years, as some have suggested,
yeah.
that they are not worried because they know this thing will take
Mm,
time.
mm,
So those are some of my inputs that I think will assist in terms of the funding. But thank you also for showing how the NHI will transform the cost coverage, where now if I need to go and access a healthcare facility, I need to pay out of my pocket. But through the
mm,
NHI, will ensure that that is scrapped, and you won't have people dying unnecessarily or dying because they can't afford, access to these facilities and the services that come with them. So I'll take a number of questions, Comrade Bacon. Maybe by 20 past or quarter past, then we can close off. And I'm sorry for going over
no,
time. There,
no, it's fine.
there are a number.
Yeah, the conversation is not between you and I. It's for the people to understand this thing. So I'm up for the discussions and the questions, no matter how long they take. I mean, it's very important. We're not talking for ourselves. We need to hear what other people are thinking.
No, thank you. Thank you very much for that.
Yes,
So
okay.
the first question is from Simli Bushiko. I think you can see it on screen. He says, how will the NHI change the status quo, except the rich going to invoice the government through the same private healthcare system? And maybe what I would want to add as you respond to this, there has been this scaremongery that, in fact, if this thing proceeds as legislated, we're going to see more of the brain drain within the healthcare sector, than we have seen. I mean, you have mentioned here that the Mediclinic report that you mentioned in your paper says, amongst others, the issues that create a deficit of healthcare professionals in South Africa is the fact that they are highly regarded internationally. Therefore, they are offered better jobs or better paying jobs outside. So is that scaremonger of saying if this thing is implemented, then our people are going to live valid? As you respond to this question by Cindy.
Yeah, hey, that's a somebody's asking me a very hard question. Look, it's two ways. The first way is, of course, once you go to a private hospital and the state subsidizes that, your services or whatever that you get from the private hospital, someone look at it as it's going back to the rich. It's going back to the private. The money that the state will pay goes back to the private hospital. But also, someone can say it will also be taxed by the state. The state can still tax the hospital to get back some of the money that it pays. So the money is a cycle. Yeah, state pays you, you use it. When you use it, state taxes you. So when you have good revenue systems, you get the state is able to get back the money, through taxes. Firstly, and then secondly, it does change status quo because currently, if you don't have a, a medical aid or money to go to a private hospital, you won't be assisted. You won't get the services. So the status quo will change in an instance that you will now have access to public hospital that have good that at the time will have good professionals that are going to assist you, or if they don't have those type of professionals, you can go to a private hospital, get assisted. So that will change. There's going to be a huge impact in that effect. Also, remember what I said about NHI. It's not only about medicine or about dealing with the disease from a hospital, from a health institution, but also with the public profile that's going to be created and the patient profile that's going to be created. It's going to assist you to live longer because now when a doctor assists you, they're going to know your health background. You know, they'll understand you better. They'll understand your community better. When they assist you, they will know what to use because now they understand you better than now. We just come and then they inject you whatever that they do. So it will change the status quo. This policy is very good. It does have its own shortcomings, but on the aspect of changing the status quo and also allowing people access to health, I think it's going to do a very huge change in our health system. Secondly, on the I'm really concerned about and I think in the paper you would remember I even talked about Cuba. I'm really concerned about medical and look, I know that they have a right to choose what they want. They have a right to go overseas if they have right freedom of movement, freedom of trade. They can go wherever that they want to go and offer their skills. But I'm worried if our education system creates professionals that care less about their community and care less about their country. I'm really worried. I think if our education system is doing that, then there's a big problem with our education system. Because if you're a health professional, you need to assist everyone, and you must understand that your countrymen and women are important because the time when you were studying at vet medical school through NSFAS, it was their taxes that funded your education, and 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 also society contributes. They some of us, I remember, I'd get clothes from neighbors so I can look good at school. Your uncle from wherever will send you money to eat. So people have contributed to education, and the way to give back is to offer them these professional services to them. So if we have people that are running away now because we're going to have a system that allows those that can't afford to be assisted by you, then I think both have a problem with the education system and you have a problem with the type of professionals we have. And I think we are becoming more liberal, and I think that's a bit problematic. If we have people that just want to focus about their own stability, then it's a problem. And President Begi talks about how people just want to get rich and rich. This demon that is there now in the modern society. So I think if that's the type of people that we want to professionals that we're creating, then we must go back to a drawing board. Because NHI is not it shouldn't be a problem for professionals. Professionals must be happy that now they'll be offering services to their people, to their country. You know, so it's a problem if they're leaving us. And in fact, where they live, if they go to the UK has a similar system, just as different from
Yeah.
us. You know, the Americans had Obamacare. Well, the court said it was not. The court in the Supreme Court in the US had a problem with it. But where they're running to, there's similar systems. So I don't know.
No, thanks, Commissar. I think that point that you're making about the need for professionals to be more patriotic and more active in responding to the challenges of society really struck a chord. In fact, it reminded me of one of my favorite speeches in all history, a speech given by Robert Mangaliso Sobukwe in 1969 as the president of Fort Hare, where he says, "You have seen what education means to us. It means service to Africa," you know. And I think it's still relevant today that we ought to always ask ourselves, what is our contribution to society? And in fact, that's what Tintswalo's perspective is all about, to say young people should be and are actively involved in responding to the challenges that are facing society. And they should do that with pride, and we should celebrate those contributions. So I think for me, that really struck a chord. So we have a comment here, and then I'll move on to the questions from Koshi Kaunda Mashiko. It says liberals and conservatives, doomsayers, capitalist class is saying that the national insurance bill will make healthcare worse in its current form, as limiting private funding will weaken the national system. This is feedback from South African Health Professionals Collaboration spokesperson Simon Stratton, whose comments followed after the signing of the bill. I guess it's related to that question that I was asking about professionals leaving. Then there's a question here from Nebo
Oh
Makata
yeah,
Kuti.
I know him from
Yeah,
Sasco.
yeah, who says, how is the NHR going to address the question of overcrowding in public hospitals, the question of shortage of ambulances, particularly in rural areas, and public health staff attitudes towards patients, because these three factors are a major crisis in the public healthcare sector. I think some of these things you raise in your paper, particularly the attitude of healthcare professionals, and even sometimes the misdiagnosis that happened, which leads to leakages of funding in huge sums. I think you even made reference to some of the lawsuits, that were in place at the time. I think you said in the Eastern Cape there were claims of around 41 billion, and in Gauteng there were around 14 million, if I'm not, or the Department of Health was playing around 14 million. So, yeah, can you please respond to this question and address some of those leakages that I speak of? Because
Yeah.
I think if we close those leakages, even the funding issue would be more enhanced.
Yeah, yeah. This is a very good question, man. The first phase of the NHI is to build institutions. So if you build enough institutions everywhere, rural areas, townships, everywhere, build remember the four types of health institutions I mentioned, the ward, clinic per ward, the district, provincial, and the national. So once you've built that, remember, if you build an institution, then you're gonna have ambulance, you're gonna have nurses, you're gonna have doctors, you're gonna have psychologists, you're gonna have surgeons, you're gonna have that. So you're gonna create jobs even for the people that are from that space. So NHI primarily first phase is about that. Let's build health institutions, and in that way you will then be able to then build access to health institutions. The issue of the attitude of health professionals. Look, man, I'm not defending them, but the attitude also comes from the fact that these people are tired. They're tired. They see a lot of people. They work crazy hours. So, but if we create a 24-hour clinic, for instance, some are going to work during the day, some will work at night. So you have shifts. So you have fresh people coming to work at night. Those who are working during the day, they go rest. So you have enough human resource to work. So happy employees, happy services. So once we make them happy, then by reducing their hours, in terms of increasing their capacity, then I think the issues of attitudes is going to be sorted. And also how much they are paid. We need to look at that and try to find a way to deal with how much they are paid and how many people they see per day. I think once we deal with that, then they're not going to be always angry when we go to see them, or have longer luncheon and tea when we go see them in the public hospitals. Then, and also another issue is that I just lost my train of thought. Oh yeah, another issue that you're mentioning, the issue of litigation. Hey man, because they're tired and because there's few of them, they make mistakes, and there's a lot, especially with children. There are a lot of children in the Eastern Cape that when the mothers give birth, there's complications. The child then is born with complications, and then we sue the Department of Health. The issue there, if you study the issue there, it's the issue of the access. There's a long queue. There's a long queue, long queue. Then the lady then gives birth during the queue. Then they can't be assisted. So, or when they give birth, the nurses or the doctors make mistakes. The child's not crying. So these things happen because of the pressure that the public health system has currently, and therefore you then find that a province will spend a lot of money in litigation, where there's many cases of such mistakes that health practitioners commit. And I don't think we must blame them. I think we need to assist them to then limit this litigation. Some of them, it's the negligence is very little on the nurse or the doctor, but it's big on the hospital. The issue of the queue, the issue of the person the hospital not having a profile of the person. I remember, I'm not going to mention the parties, but I remember because I did a lot of, when I started Canada Tenure, I did a lot of such matters in the firm I used to work for. We were acting for one of the provincial, I won't mention the province, one of the provincial health departments, and one of the doctor had forgotten something in someone's head. So this person kept having, then this person here, so they stabbed him, and then they went to a surgery. The doctor forgot one of the tools that he uses. I don't know what they called it. Then they stitched him. So this guy had headache all the time until he went for some X-ray or whatever that they did, some examinations. Then they saw that there was something that was left in his head, and you would understand the doctor did this thing around 12 at night, and he probably was working for 8 hours. You see, so they're tired, and I'm not saying that I'm not defending them, but it's because they're tired. So let's assist them not to be tired. So such mistakes happen, and I think once we have more professionals, once we have more institutions, then this will then mitigate the mistakes that health professionals do or make when they're at work. I mean, you can imagine if I were to work for 8 hours as an attorney, tomorrow I'll mess up at court because I'm tired. I'm a human being. So I think we must not forget that health professionals are human beings before they're health professionals, and all human beings need support. So we must support them and assist them to execute their tasks.
So essentially what you're saying is that the NHI will help provide that particular support and consequently assist us deal with this, some of these leakages that come through litigations, because I can imagine 14 billion is a lot of money in a period of 10 years. I mean, we could have spent that in building 1 or 2 hospitals or a number of clinics or supporting the healthcare system as a whole. So I take that. And on your issue of 24-hour clinics or 24-hour healthcare facilities. I I generally think we need a 24-hour economy, particularly in all metros, as a starting point. And I mean, we have argued for this even in other platforms that included other industries. I remember when you were leading the charge on TVET must rise. One of the things we spoke about, or even the issue of student accommodation, one of the things that we spoke about is the need to create 24-hour economy student villages. You
Yeah.
know, and I hear that argument now
Yeah.
uh,
Yeah.
becoming part of the public discourse, particularly in Gauteng with the MEC of economic development, Tasnim. She, Comrade Tasnim, she likes speaking about this need for a 24-hour economy. And I think it's very important because, in part, it will help us deal with some of the challenges raised here and even others, including crime. I mean, you can imagine if we're all active 24/7, it no longer becomes easy for people to commit crime willy-nilly. So I think the need for 24-hour economy is very important, and it's good you show us how it will assist the healthcare system. Another
Yeah.
question here is from Mashandu Mbata.
I think you must invite, sorry,
Uh,
you must invite Leslie Ramutlo to speak about the 24-hour economy. It's his idea. All I did was just to write a paper, but Leslie Ramutlo is passionate about 24-hour economy. You must invite him to talk to him about that.
yeah, he's on the pipeline. He's on the pipeline. Yeah, he's on the pipeline. We'll definitely have him soon. There's another question here. It says, would this mean the NHI will benefit the poor more? I think the direct answer is yes. Let me add in another question as you answer this one so we can move with some speed. Okay, I see a comment here saying, considering the fact that in the current form and state, government is already the biggest employer compared to private sector, while the biggest chunk of the economy still belong to the in private hands. Do you think the NHI will bring more tax burden to the middle class and workers generally than the captains of industry who operates in the country but spend their fortunes abroad? Where since even the corporate income tax has been decreased to something around 28% from 34%.
Hey,
Yeah. So in
tax.
essence, he's speaking about the skewed patterns of our economy, right? To say, and I guess he's responding to my idea of broadening the tax base, particularly the income tax base, to say, considering that there are these huge disparities where public sector is the biggest employer, but the wealth lies in the hands of private sector, and more taxes are actually coming from the public sector. So, would that not automatically disadvantage people who are in the public sector, particularly the middle and working class?
Yeah, look, the topic about tax, man, is not easy. You I just thought about the argument that why am I forgetting his name? Makes in capital in the 21st century. Thomas
Thomas
Piketty.
Piketty.
Thomas
Thomas
Piketty.
Piketty, yes. Yes.
That tax tax the rich more. uh, I don't think when you tax the rich more, you or corporate more, you're dealing with the tax issue. And I'll say why I'm saying this. The You can't force investment. You can't force. You need investments. Look, you need investments. You need to balance investments in your domestic markets and domestic role players. You need to do that. But you can't. And you also need to export. Your products to other countries, and then money comes in. There must be capital flow. Uh, in the country. So if you want to have strict tax uh, policies, you are going to chase away investors. I know it's something that politicians say, and people think it's not real. It's real. If there's what Jonas Center call an investors protest, the economy won't grow because you need people that have the money to come and put in your ideas or in your economy so that the economy grows and you have more role players. So I don't think we need to be strict in our corporate tax. I don't think it needs to be higher. I think it has to be moderate. But when it's moderate, we must also make sure that we take a chance to domesticate our markets and create the domestic role players in the economy. I think that will be my personal response to that. I mean, if you look at for instance Joseph Stiglitz's work, Stiglitz says create social capital, create other means of capital in your country. Don't rely on money, but create other means of capital so that you are able to survive. So that's what we need to do for us to survive. So I don't think we need to be strict and tax corporates. I think what chasing them away will be the end of our economy. I think we must be very moderate and deal with it in that fashion. Um, the middle class, we can have a debate. I mean, just that we're not talking about that now. I, what is the middle class? Theoretically, what is this? What is the middle class? When I was a student, I was a typical Marxist scholar who just believed there are two classes, and I still stick to that. Others are just stratas; they're not classes. The so-called middle class, for me, doesn't exist. It's a strata, and I think we create this middle class concept, and then we become scared of the middle class. We then think that we don't even touch the middle class, and we become very everything. Even Twitter is middle class, middle class. Everything that happens, the middle classes are taking. But if you look at the people that are the so-called belonging to the middle class, most of them don't have medical aids. Number one, most of them want this NHI, and so honestly, I don't think we were such that has created the so-called middle class. I think it's just people that are in the strata, people that are for people that their credit profile, it makes them be worth of credit, and they have almost everything that they have is on credit. So I don't think really that there's a middle class in this country. So yes, people that are working are going to once you work, you must pay income tax, and income tax will go to services to service you. Also, you are going to be serviced by this income tax, that by these taxes. The problem is the corruption that is there, not the idea of taxing and the tax and then money that's being taxed is used for services. The problem is the money might not be used for services; it's used for something else. That's where the problem lies. But the idea of taxing people who are working is a good idea, and that's how the economy runs, and that's how the current model economy is run. So I think, but you need to balance these things. There's no one way boxing. That's the issue. Theory shouldn't be like that. We must be flexible in how we apply theory. If we are too rigid in our application of theory, then we're going to have a huge problem as a country. So I think we need to always find a middle ground and then work on it. I know someone will say, no, just Lobo says there's no middle ground. There is a middle ground. In reality, there is a middle ground. I know I grew up a Marxist, but in fact, Marx himself didn't say that there's no middle ground. There's no work of Marx where Marx says there's no middle ground. He knew that there's going to be stratas. That's why in the Communist Manifesto, he talks about how industrialization will create these stratas. People that are going to be forming alliances with the capitalist class. He knew that that thing was going to happen. He writes it when he critiques the Gotha program. He talks about such things. So I think we And I'm being controversial, but I think we need to be very strategic in how we deal with the so-called middle class and so-called capitalist class, and how taxes are used. I think let's tax people, but let's use the tax monies efficiently to assist the same people that we're taxing. Um, I don't know, but that's how I look at it.
Yeah, ladies and gentlemen, that is Bhekithemba Mbatha for you. There's no conversation where you don't get some lecturing on Marxism. The man is a core Marxist. I sometimes wonder how your colleagues deal with you when you have these conversations, because I know that on your tongue, Marx is forever dwelling and ready to express himself. Um, so I'm going to ask you two last questions, my brother. We have went way over time, and thank you so much for sparing this time and answering to the questions that our audience have posted. And thank you to the audience for being this engaging and being with us. I think we are sitting on 52 and counting people who are joining us live across three streams. And this thing will always be there for people to refer on the social media platforms in which it is streaming. The second last question I want to ask you is, what lessons can we learn from other countries as we implement this policy? You've already alluded to Cuba. I think in your paper you mentioned Cuba and China. So, what are the concrete lessons that we can learn from there?
Yeah, the Cubans are health is their daily concern. They've socialized health. So whether you are rich, you are poor, you're from wherever you come from, your health education, understanding what health is, and also love for health. The Cubans have made that to be their daily core. One of the principles of building that democracy is that everyone must have access to health. So we need to have the same attitude towards that. So we have Ubuntu, but we need to then link Ubuntu to health, because Ubuntu is about social well-being of a human being. What I must owe my well-being to you, and by that it means I must make sure that you are healthy, and you are well, and your well-being, you have the ability to live, you have access to food, you have access to shelter, you have access to clothes. So all these things are the Cubans have they master it. So I think we need to learn the same thing, that it shouldn't be health. Our health topics must not only come when we talk about hospitals and clinics or medical aids, but our health topics must be about, for instance, how many times a bath a day, how many times you eat. That's health. How many times you wash your clothes. That's health. So the Cubans, they that's how they deal with health. They deal with health as a social phenomenon, as a social, as an important social institution. If I were to put it, you can't have life without health. So that's how they look at it. They look at it as part of their values, from home, society, and the country. So I think we need to have the same attitude towards the Cubans, and also I think we it shouldn't be that we should break the stigma that is created by sickness. Sickness doesn't mean a human being is no longer a human being. They're now something else because they're sick. Once we also break the stigma on sickness, then the person that is sick is going to live longer, because they know that I have my brother or my sister, or anyone else to assist me, because I know that I have people that I can cry, or I can cry to. So once we also deal with that, then we will be able to address our health issues and our illness issues and our virus issues and disease issues quite better, with a better understanding of these things, but than just to treat them as only doctors must deal with sickness. So I think, obviously, when it comes to examination, only doctor must do that. Don't examine other people. But I'm saying, when it comes to understanding the sicknesses, so health education must be very, very prioritized. We need to understand basic health basic health information must be available to everyone, so that we know how to assist each other, and understand that someone who's HIV positive, for instance, can still live longer. Someone who has diabetes, we must not look at them and treat them differently from other people. So I think we need to deal with the stigmas, and in that way we'll then be able to deal with we'll learn from how other countries deal with it. Um, you know, I think South Africans deal with HIV different from other countries. We're better now. You find things like Amagamai 3, Z3, all these funny things that people say I'm just making an example of the issues we have. So I don't think in other countries there's a stigma on people living with HIV. So we need to learn from that, and be able to fix that. The Chinese, they are good in creating institutions. So they've created these models, these institutions from what, to they've created that. Access to health, easy. So from them, I think we must learn that we must have health institutions. It can't be that you go to a place and there's no clinic. The first thing that you must see when you go to a ward is that, oh, here's a clinic. Okay. Whether it's a mobile clinic or a clinic that's built, but there must be a clinic so that people can have access to healthcare. So I think the Chinese, that's what we learn from them. And even the capitalist countries are doing this thing. Obamacare, for instance, and the national health scheme in the UK. So I think we need to take a progressive view on this thing, and internalize it as a country, discuss it, and change our attitudes towards it. It shouldn't be about tax. It shouldn't be about medical aids. People have reduced NHI to tax and medical aid, and understand, because people they talk about tax because it comes from their pockets. I understand that, but you're going to benefit from it. You're going to benefit from it. So, and medical aids are going to be there. So there must be no scare about this thing. Um, and I think the more we have such discussions, then the scare might be limited.
No, thank you very much, Comrade Becky, for helping us unpack, at least have a basic understanding of what the NHI is, what it entails, and its possibility in transforming the healthcare system. And I think one of the things we go away with is that this is a broad conversation that we need to keep having, break it into sessions. One could be, how do we build the institutions that are required to practicalize this thing?
Mm.
How how should we think about the funding model? You know, how do we also socialize this thing? Because I think part of the scare is that this thing has not been socialized enough, and that's why people think, it was something that was signed into law haphazardly and it was rushed, not knowing that in fact there's been a more than decade process that has taken place before we could get here. So I think it's important to have this, keep having this conversation in breaking it down. I think the other important thing is the social compacts
Mm.
that
Mm.
must be forged to make this thing work, because ultimately it will require all of us, all key role players and stakeholders, to come together to make this thing work. So, my brother, as your parting shot, we are going into elections in less than 8 days. I think we're
Yeah.
7 days away. Why do you think it's important for young people who are on the voters' roll to go out there and vote? And as you respond to this question, you can give us your parting shot. Thank you for your time. I think we went overboard, but I think it's because of the importance of the conversation and how well you are unpacking the issues, and the wealth of knowledge that we are getting from this conversation. The paper is there. If you would allow us, would share it on our platforms so that people can engage with your ideas more. I know that you have said there's a possibility that you might develop it further, but if you grant us permission, we can share it as is so that people can get to engage a bit more with some of the things that you raise.
Yeah. I saw some grammatical error there. in the paper. When I went through to read it, yeah, it'll be great to. It can be shared with a disclaimer that there are some grammatical errors that are in the paper. But it can be shared. I think it can be shared, and people discuss that. It's very important.
Thank you.
Yeah, the issue of I think, look, man, the right to vote in this country came with came with a lot of sacrifice that young people, made, because most of our freedom fighters, when they fought for freedom, they were young. Some of them died very young, and we need to then take the baton from them, and the only way that you can take a baton from leadership or from someone is taking action, and taking action is through voting. Voting is important. When you are not happy about something, you can remedy it by voting. And of course, there are some public platforms that you can go through, public participation. Like the NHI went through public participation. Some people don't know, but went through public participation. So we need to emphasize the importance of going through such discussions, and also participating in public participations, and standing in the queue to vote. It's very important. It came with a lot of sacrifice. And it's a right. It's a right. You can't want to complain about leadership, but you're not taking action, and or you're just sitting at home, or you prefer specific leadership or particular leadership, but you're not taking action to make sure that they are there. So you can't just have preference of leadership, but you're sitting at home, you don't go and vote. So I think voting is very important, especially young people. We need to wake up on the 29th. It's not a holiday. It's a very important day in the history of this country and the calendar of every after 5 years, to go there and vote, both in the provincial and national elections, and also in the when we vote for the ward and the PR councillors, the local elections. We also need to go there and vote, but also not just vote, but also have young people in these lists that are there, that parties, because we use a party list, or even independents that are young. I think it's very important that we have young people that are independents, and young people that are also in these political party lists, so that young people start to take over the country. So I think we need to telling someone that we are currently the adults of society now. You know? I've turned 30. I'm in my third floor now, so we're adults now. Some of us have children that are in primary school, so we need to be responsible. And the only way to be responsible is to go vote. So we need to take action and take responsibility to go and vote in the coming elections. I think that's as far as I can take it. And thank you to the Tambo School of Leadership. I'm grateful for the time that you gave me, and to share these ideas and to have a conversation with everyone. Thank you for consideration, and thank you for the opportunity. I hope this conversation will reach many people, and more people will engage. And I'm available on social media networks for engagements, and more discussions on this. I think it's a very important topic, especially because it deals with health.
No, thank you very much, my brother, and have yourself a good night. Thank you very much to our audience for joining us for today's conversation. I know that we have went overboard by at least 40 minutes, but as I said, it's because the conversation was so informative. Sometimes you can never have enough time on the conversations that are necessary for us to have. As you have heard, please engage other people about the NHI. Let's socialize the NHI, and allay people's fear that this is not a path to catastrophe, but it's a path that will actually help to transform the healthcare system of South Africa and benefit all of us in the end. So thank you so much for joining us. This is Tintswalo's Perspective, where young people share their views uncensored about their perspectives on a variety of issues of their concern. This is where the youth share their reflection of the last 30 years of our democracy and showcase the work that they do in order to transform society. Please join us again next week as we have another fruitful conversation. We are probably, and I'm saying probably, going to have a conversation about what to expect when you go to the voting station next week, Thursday. You would all know that instead of having two ballots, we're going to have three now. And we're going to be unpacking that and what that means, and also the do's and don'ts when you get into a voting station, so that we don't have our ballots being spoiled and therefore being invalid. So we're probably going to have that conversation. Stay tuned on all our social media platforms as to who's going to be helping us to unpack that conversation. Please do spread the word that the Tintswalo's perspective, it's growing, and it's a very exciting platform for young people to engage and learn from each other. Thank you very much and have yourselves a good night.